Hello guys, welcome to my channel. Y'all are gonna see me like 20 times today. Oh, I need something to hold this. Oh, damn. Okay. Guys, hello. So we're gonna talk about the brain. We've spoken about the brain earlier, but this is just pretty much what could go wrong with the actual brain, like in general. So when it comes to the brain, you could have a tumor to the brain, right? You could have nerve compression because, okay, your brain is like, I feel like your brain is like the heart of the body. Like, it's just amazing what your brain can do because your brain pretty much is in charge of almost everything. Like, it regulates your breathing. It kind of gives signals to your body for you to get up and walk and look and talk and swallow. Every single thing, your thoughts, and we'll get into psych in the next few other videos, but your brain is like amazing. It's just amazing. Okay, so we'll focus on this video on the mode of physiological things that could go wrong with the body, as in what could physically and physiologically go wrong with your body, rather than like neurotransmitters or chemicals in the brain. Okay, so physical things that might happen to the brain. So the first thing that might happen is that you can get a tumor in the brain, right? You can have trauma in the brain. You could have a clot in your brain, which will stop blood flow. You could have an infection going on in your brain, and you could have you could have nerve compressions because your brain also has like nerves, like your brain going down to your spinal cord has nerves. And hemorrhage, there are three types: subdural, epidural, and intracerebral. So first, when we're talking about the tumors in the brain, so you have neuromas. Neuromas is pretty much like a tumor that will press onto your eighth cranial nerve, which is your acoustic, like being able to hear. So with this, I'm thinking you will have problems with balance, coordination, problems with hearing. So pain in the ear, being able to hear and balance. And then the most common tumor is called an osteocytoma, and it can happen pretty much anywhere in the brain, like the pineal area, which will cause trouble with sleeping. Is it pituitary, which might affect your ACTH levels, which helps with corticosteroids and all that stuff. Also, it can really lead to a headache, a really bad headache. In general, anything irritating the head will cause a headache, whether it's muscle tension, whether it's just muscle tension to the brain, and I would know that. Whether it's so just relax. Whew, I need like a relaxed medication. A glass of wine every night. Anyway, I'm going out of off tangent. And so you could have a clot in your brain, and this is also called a stroke. And with this, there will be lack of blood flow to the brain, which lack of blood flow causing something called ischemia, or lack of oxygen to the brain, or an infraction, brain death, which I don't have the symptoms of brain death now, and I think I gotta look that up. The other thing you could have is trauma. So with trauma, there is concussion, which I think all of you guys know, and then there is a scalp problem with the scalp itself. Like, let's say you had an injury and it affected your scalp, or you could have trauma to the basal skull. So with concussion, the patient might briefly have a disturbed level of consciousness, but the physiological or the anatomy of the brain is going to remain intact. You can have amnesia, a little bit of amnesia, and before vomiting. yeah, you could also have headache, dizziness, and vomiting. Headache, dizziness, vomiting, brief amnesia, like saying nonsense, pretty much. So that's a concussion. A concussion is no, I mean, a complication of a concussion might be, I forgot the name of it, but we'll talk about that in psych. Pretty much it's when the brain accrues so many concussions, it leads to this something called it's like a type of dementia that would affect your ability to walk, I think is, and your mood, your ability to walk, your mood, and I can't think of the rest. We'll talk about that in psych. Yeah, so with the scalp, trauma to the scalp, the main thing about this is infection and bleeding, like bleeding heavily and infection. Trauma to the basal skull fracture, this is really bad. It might cause a leakage of cerebral spinal fluid, rhinorrhea in the nose, or I don't know what this one is called, but also otorrhea, yeah, otorrhea and rhinorrhea. And it might also cause something called ecchymosis, which is pretty much bruising in the back of the ear. I think it's called the beetle sign, the beetle sign. Yeah, so that is that for basal skull fracture. And also with cerebral spinal fluid, if you see like a little like, I can't think of it now, but I have a picture of it in my head, like kind of like something, a stain on your shirt, and it's just like, it's hard to explain. I'll talk about that later. But then with the brain too, you could have infection like I talked about. A common infection is meningitis and encephalitis and something called CVG, I can't say that name, and a brain abscess. Meningitis is pretty much inflammation of the meninges, which is the membrane of the head. So the meninges of the head and a little bit of the spinal cord. With this, you have something called nuchorigidity, which is like, when you flex your neck a little bit, it hurts. You could have something called the Koenigsegg sign or the Brudzinski sign, where when you flex the head, you are also flexing your lower abdomen, like it kind of goes together and it hurts. Or the Koenigsegg sign, when you kind of lift the leg up, the other part of the body kind of hurts. With this, you might also have photophobia. So with these infections, you want to have low stimulation in the room or whatever, With encephalitis, it is pretty much inflammation of the brain tissue, usually caused by, and I forgot to say with meningitis, is caused by a strep B. Yo, is it strep B? What is it? God. Okay, so strep B. I gotta look that up. Okay. Alright, so with encephalitis, inflammation of the I didn't even write that down, but it's inflammation of the tissues of the brain, and it's viral, whereas meningitis could be viral or bacterial, with bacterial being the most common. Encephalitis, we're going to treat it with antiviral medications, whereas meningitis was mostly treated with antibacterial medications. With encephalitis too, we'll see Parkinson-like symptoms, chorea, hallucinations. What else? Flaccid paralysis. Flaccid paralysis. And it could also be caused by a fungal infection, which we will treat with amphotericin, which is one of the drugs that is nephrotoxic. There's another one which is Creutzfeldt something, CJV. It is an infection caused by prions. And this is very interesting because this one is not a virus or a bacterial, it's a prion. So it's smaller than a virus, and it's hard to disinfect this because it is hard to sterilize it like regular things. And it's not, we don't catch it by touching things. You catch it by infected beef, and people who have been in that area, like where there was an outbreak of an infection, like in England. You want to stay, you can't, or you won't be able to give blood. And there's no cure for this. If there's no cure, it affects your sensory, your memory, it affects your affective, sensory, motor, cognitive, affective, sensory. So if I knew what affective meant, affective, sensory, motor, and cognitive. Okay. And then the last one with infection is the brain abscess, which is pretty much accumulation of dead white blood cells in the brain, where we will use a craniotomy or burr holes to get rid of the abscess, because it might increase intracranial pressure. So pretty much any sort of infection happening close to the brain or near the brain can lead to an accumulation of brain abscess in the head, causing increased intracranial pressure and signs and symptoms of increased intracranial pressure. So the other thing that could happen to the brain is bleeding. There are many forms of bleeding. You have an epidural bleeding, which is an emergency. It happens when there is a trauma leading to bleed just below the cranium. With this, the patient is going to have signs and symptoms like right away or readily. And this is an arterial bleed. Arterial bleed, also called from a trauma to the meningeal artery. Okay, this is an emergency, and there's a subdural where you might not see symptoms right away. It might come in like 2 to 3 days after. The patient might be just a little bit confused, like a few days later, maybe complaining of a fall or something like that. The bleeding is venous. We can usually treat this, and I don't know how we'll do this, probably by giving mannitol or doing a craniotomy to get rid of the doing a craniotomy to get rid of the fluids in the brain. Or you could have intercerebral bleed, an intracerebral bleed where it happens from like either AVMs, which I learned like a long time ago, aneurysm, or hypertension, from the subarachnoid, which happens with cerebral amyloid, primary hypertension, and secondary AVM. So primary being the most common one with hypertension, secondary AVMs, which is aneurysms. Okay, so that is that. I feel like I'm not so like comfortable with this material all the way, but so that is that. You could also have a nerve compression. With nerve compression, a good example of this would be the trigeminal neuralgia. With trigeminal neuralgia, there's a pressure on the fifth cranial nerve, which causes sudden paroxysmal pain, usually unilateral side of the face. It's so painful, and it can be stimulated just by air. It can be stimulated by touch, by brushing your teeth. So usually these patients, they are afraid of eating because they think it's going to stimulate that pain, and that pain is so painful. So pretty much care for these patients is we want to avoid having them eating on that side where they usually have the attacks. We want to have them not eat hot foods, and also what else? And the other thing about trigeminal neuralgia is very common in women and patients who have MS, which is multiple sclerosis, and we'll talk about that in the next video. The other nerve compression or inflammation that might happen is something called Bell's palsy, and is inflammation of the 7th cranial nerve, which is the facial nerve. You might have pain usually on one side of the face. Usually people are confused because this might kind of look like a stroke, because the muscle on one side of the face will just kind of like droop, so they will have trouble talking. I'm thinking even trouble talking, even trouble swallowing. What else? They will have drooping of the eyelid, facial weakness. So, and is Bell's palsy is also caused by viral. So far the things we talked about that are caused by viral infection is Bell's palsy, encephalitis, and in the next video we're gonna talk about GBS or Guillain-Barré syndrome. Okay, so that's it for this video. And in all, if I would like to just put emphasis on again if I would like to put points on this, is just when it comes to the intracerebral bleed versus the subarachnoid, it's just very important to know that epidural bleed is an emergency, so they need to go to the hospital. We'll do a CT scan, see what's going on, possibly do a craniotomy, just knowing that. What else? The intracerebral is just like things that will cause us really massive headache, like hypertension or AVMs, which is a subarachnoid bleed, or primary hypertension, subarachnoid, AVMs, and subarachnoids, amyloid, and secondary AVMs, and some medications. Okay, so that is that, and I have to look into CVG, how it affects your affective, your sensory, your cognitive, affective, sensory, motor, cognitive, so all the 3 factors. Okay, so thank you for watching my video. I will talk about some big conditions when it comes to the brain, neurodegenerative or immune conditions in my next video. Thanks for watching. Bye.